The federal government has taken a significant step towards addressing the public health crisis linked to excessive sugar consumption by announcing its commitment to increase the current sugar-sweetened beverages tax. The tax, currently set at 10% or 10 naira per litre, is slated to rise to 20% of the retail price, aligning with the recommendation of the organization. Coordinating Minister of Health and Social Welfare, Professor Ali Pate, made the commitment during the National Conference on Sugar-Sweetened Beverages Tax, organized by Corporate Accountability and Public Participation Africa. Correspondent Lois Abasambo has the details.
Nigeria is said to be amongst the countries with 77% of the global 41 million deaths caused by non-communicable diseases. Coordinating Minister of Health and Social Welfare Professor Ali Pate, who was represented by Dr. Chukwuma Anyaike, said the federal government is willing to increase the current 10 naira per litre tax on sugar-sweetened beverages in order to discourage the consumption of such products.
The introduction and sustenance of SSB tax in Nigeria will reduce excess consumption of sugar-based beverages and thus reduce the burden of non-communicable diseases in Nigeria. The Federal Ministry of Health and Social Welfare is committed to attain the global best practices as recommended by the WHO.
In his opening remarks, Executive Director, Corporate Accountability and Public Participation Africa, CAPA, Mr. Akimbode Oluwafemi, emphasized that a staggering 30% of all deaths in the country are directly linked to non-communicable diseases, underlining the critical need for immediate and comprehensive action to address this growing health crisis.
One of the critical recommendations of the Presidential Committee on Tax Reform should be an increase of this tax and a legal framework to ensure that we don't even need, again, the yearly budget or fiscal document for that tax.
Health experts and government officials expressed their commitment to working together to develop and implement policies aimed at reducing the prevalence of non-communicable diseases.
With increase in non-communicable diseases death, it is our commitment as a people to ensure that we reduce the burden of health on our nation.
We really need to look at how we can intervene to ensure that the health of the common citizen is put at the forefront of every policy-making decision.
As Nigeria grapples with a significant share of the global non-communicable diseases-related deaths, the focus on curbing high sugar-sweetened beverage consumption takes center stage. The government and public health advocates are working hand in hand to address the alarming statistics and reverse the trend with the goal of promoting a healthier future for the nation. Lois Abasambo, ASO Television News.